Hi, and welcome to the world of veterinary neuronal adjustment. VNA, also known as veterinary orthopedic manipulation, was founded by Dr. Bill Inman in the early 1980s as an alternative to invasive surgical treatments for animal diseases. Dr. Inman has prepared this brief CD to help you understand how VNA can treat and even cure many of the diseases you encounter on a daily basis. Since no drugs are used in this treatment modality, VNA has been a boon to many practices because clients are attracted to natural treatments for disease states. In the next few minutes, you will meet some of the pets that have experienced the healing potential of VNA firsthand. First, you will meet Casey Reyes, a beautiful Doberman pinscher with Wobblers syndrome. After Casey, you will meet Spanky Magruder, a spunky 15-year-old Westie with spondylosis. Finally, Gypsy Kudrick, a feline senior citizen with hyperesthesia syndrome, will make her acting debut.
My name is Beverly Reyes, and our dog Casey has been treated by VOM. She's had approximately 6 treatments, and after every treatment, she has really improved tremendously. She was constantly falling, and you could see she was in a lot of pain. Now she's walking and even attempting to run. She's able to go up and down the stairs without any problems, and she's having a good time.
So what we have is, this is Casey's x-ray, and it was diagnosed and taken in this hospital, and what we see is a number of relatively normal joint spaces in the neck, but when we have 2, 3, 4, 5, 6, this area, of course, there's no joint space and they're collapsed. They should have a space like this. They have no space. What's occurring is this particular vertebral segment is moving down relative to this one, putting pressure on the cord, pinching the cord right here, and that produces a pressure on the ventral aspect of the spinal cord, often called the rubrospinal tract, and it will affect first, and this is important, the rear legs. As it continues to put energy swelling in this area and injury, then it's going to affect the front legs too, which is now it's starting to do. This particular surgery would be, the surgical extirpation of this would involve going in and putting a ventral slot from here to here, putting in a cyanomethyl acrylic bone glue, if you will, and trying to glue these 2 vertebral segments in place so we don't get any motion here relative to here. And what that will do, if it's successful, is it'll save this particular area. However, all the energy then will be transferred to this joint or this joint, and 8 or 9 months later, the dog will be back with the same problem here and here. And so a surgical fix just temporarily postpones the problem. It will manifest from itself to here, and so it's our goal to go in there and rehabilitate this joint.
Casey is a member of our family. She's not just a pet, and we really love her. She's an important member of our family, as I said. And now that you can see that she's not in pain, it really means a lot to us.
My name is Marlene Kudrick, and this is Gypsy, our 13-and-a-half-year-old cat. We have noticed for some time that she was sensitive in her lower back when we would pet her or groom her, and she would try and bite us. Then Dr. Palazzola told us about the VOM treatments, and she's been receiving them, and she has no sensitivity in her lower back, and they have also given her more energy and increased her appetite. As you can see, we can touch Gyppy in her lower back and everything is fine. And we're very pleased with the VOMs because I think in her senior years, she deserves a high quality of life.
The feline is an interesting case. Although we're able to use autonomic nervous system disease treatments in the dog, the cat, and the horse, in the cat it's particularly prevalent. Disease conditions such as Feline Hyperesthesia syndrome, chronic inflammatory bowel disease, borderline diabetes mellitus, and many, many others are problem areas in the feline. Megacolon is another classic one that we treat classically in VOM and VNA technologies in actually redirecting energies and balancing out the autonomic nervous system such that we can get these problems taken care of without medicines and surgery.
Before we brought Spanky in for therapy, we thought she was just getting old and slowing down, and after 1 or 2 treatments with VOM, She became a lot more energetic, a little more spunkier, and we think we have a new dog now. She has a lot more energy. She wants to go for walks more times during the day. Before it was once a day I could get her out. Now I get her out 2 or 3 times a day. She plays with the other dogs. She could keep up with them, where before she wasn't really interested. And now she has a lot of interest in a lot of different things.
Keep going, Spanky.
That's good.